Welcome to Two Gals in a Glass Half Full. We are Dr. Jess and Dr. Bobbie, two physical therapists just trying to live healthy most of the time and doing our best to see our personal glasses as half full. Some days this is much harder than others. On this podcast, sometimes we interview others more knowledgeable than us on different topics to teach us about things we do not know, and other times you are stuck with Dr. Jess and I sharing our information and knowledge. So make sure you hit subscribe button below, follow us on Instagram, and join our free Facebook group to stay up to date on all the Two Gals happenings. I am so excited about our special guest today and the topic that we are going to talk about. But first, let's start. Dr. Jess, what is in your glass?
So today I am getting my caffeine in. So I did have half a cup of coffee this morning. I've had my smoothie. I had a cup of water. And so now I'm going to have one more cup of coffee. It's a low acid type of coffee. So that way it doesn't mess with me too much with a little half and half. Yeah. So Dr. Bobbie, what's in your glass?
I am on just plain water, H2O.
I love it. And so today we have a doctor with us. Her name is Dr. Kristen Halland. And so before she does her introduction about who she is, Dr. Halland, what's in your glass?
Good morning, everyone. This is a nice, clean electrolyte powder.
I love it. Super important. It's warm here in Florida. And so staying on top of that electrolyte balance is like a constant struggle so that we don't get dehydrated. So it's not just about water, but having that balance of electrolytes is hugely important. So Dr. Halland, tell us a little bit about you.
Yeah, well, good morning, everyone, and thank you for having me.
Mm-hmm.
I am a functional medicine physician, and I'm based out of Chicago. It's definitely winter here, so we don't have as much of a struggle as you do. And I also will explain what functional medicine means a little bit in case people aren't used to that term yet. But I'm a functional medicine physician and I practice with a integrative group based out of Chicago and the suburbs. And so in the integrative group, I'm working with a lot of different healthcare providers on a huge spectrum ranging from conservative prescribers all the way up through alternative medicine, energy work, traditional Chinese medicine. And I see myself as somewhat in the middle.
I like that. And so functional medicine, I love it, but can you tell us a little bit more about that?
Yeah, I love it too. I'm glad to have a chance to speak about it. Functional medicine is a practice style in healthcare. And what it means to me is that it focuses on natural opportunities. So we're not anti anything at all, actually, but what we want to do is utilize as many natural tools as possible. And so a lot of the tools that I'm going to use to help people reach their goals or correct their healthcare imbalances are things like diet or professional grade nutritional supplementation or lifestyle modifications. And it's also something that's very objective. We like a lot of lab data and we believe in personalized chemistry. So there's no one size fits all. And probably in your practice also, you notice certain themes in different patient groups, but you could have 10 people with the same diagnosis and you're never going to write this 10 of the same treatment plans. So it's very, very personalized, and personalized medicine is always best. And it's also something that is very logical, very well thought out. We always have short-term and long-term goals for our patients' plans. So, it's okay to help someone feel a little bit better and use Band-Aids and healthcare. That's fine. I do that too. Sometimes people need to feel better to do what, we really need to do for the long-term work. But what we're hoping to do is that root cause, that long-term work. And maybe even one day, the patient will become a wellness patient, get themselves to a really, really good place, and then think more from a preventative mindset. So I can't speak for everyone, but for me, that is what functional medicine means.
Mm-hmm. I love that. Yep. The two things in PT, we say sometimes, a lot of times you'll hear someone that's trying to lose weight or someone that has knee pain and they might be slightly overweight or, more overweight, you just need to walk. Well, if they have pain in their knee, they're not going to walk. So that we kind of do the similar thing with physical therapy. We got to decrease their pain first. And if we can decrease their pain, they're probably going to be much more likely to go on that walk and to, go do the things they need to do.
Yeah, exactly. Short-term and long-term goals.
Yes, I think that's really important.
Yeah, we're also very much whole body practitioners. So everything is actually way more interconnected than we often suspect that it is. So with the first time we meet a patient, typically we're going to ask them about all of the systems of the body, not just their primary complaint.
Mm-hmm.
I think, which is super important, because if we don't have a good understanding of the whole baseline of what's going on, then how can you actually truly effectively treat something that is currently dysfunctional? Because it all interrelates. There's no one system that completely functions independently of another. That's how our human bodies are able to be complex and move and function and do everything that they need to do. Yeah. So I think the more that we see the connection amongst everything, the better results we're going to get. And then the less quote unquote medicine that we need, and it creates less dependency. And so it creates more independence, which I love. Yeah.
But as I say, Dr. Jess and I also love preventative. We can't, in the physical therapy world, you can't prevent every injury. There's going to be accidents, trauma, things like that, but there's so much that we could be helped and prevented and stuff. So we love the preventative model of healthcare as well.
Yeah.
And how we get there is knowledge. So knowledge is so much a part of getting ahead of things, is knowing what to do to get ahead of it. And so that's kind of the point of this episode today, is talking about getting ahead of things as much as possible by using nutrition as a way to be proactive with our thinking. So instead of waiting until we have diabetes or waiting until we have some sort of like major GI distress, what if we thought in advance of like, what if I could just get my body to function better based on the fuel that I put into it, based on my own physiology and how I do as a human? And everybody's going to be a little bit different with how they process, but the thought is, let's just provoke this conversation and provoke thought, and then talk to somebody that knows more than we do, hence you're here, and then hopefully other people can start spreading the knowledge of how important nutrition really is. And that doesn't mean a diet. That doesn't mean losing weight. That doesn't mean we're talking about nutrition to help your body function. And so that's kind of a little bit of a different way of thinking about food that sometimes I think our society misses. So, all right. So now talking about like big picture, and then we'll get a little bit more specific, but we hear about eating healthy. And so that's like this, it feels nebulous, right? And so it's like, where do I even start? But first, I think we've got to think about, is this really effective? Does eating healthy actually affect our health?
Well, I'm going to argue that it's incredibly imperative, of course, to our health.
Yeah.
Dr. Jess, I couldn't agree more. I loved the way you were using the word function. Because being healthy doesn't mean minimally acceptable and absence of symptoms. It means that you function well.
Right.
So, there's a lot of different things in our, main culture here that if we think about it just a little bit differently, we would realize are very, very nutritionally based. Diabetes is a great example. Diabetes type 2 used to be called adult onset diabetes, is nearly almost always a nutritional disease caused by food, and the solution can also be food if appropriate for that patient. Another really good example is osteoporosis or osteopenia. That's a progressive metabolic disease related to nutrition and nutrient status. But even if you're not talking about different diseases that can be associated with nutrient or dietary depletions, just think about the average American. They're probably eating 3 times a day and maybe also some snacks. That could be 100 times per month that you could give your body a message about how to behave and what to do and how to function. So I think it's actually very powerful.
I love that answer, because I think overall, we really can see food in a lot of different lenses. And so if we take a step back and we don't necessarily see food as like, oh, I do this because I enjoy it. But if we take that step back and we look at food in a different way of like, what can actually this do for me? Then it completely changes how you look at what you're eating. And so you can still enjoy it. At the same time, you can ask more of it and say, I actually want to get something from this energy and money that I'm spending, and I want to have better function in my life. So you can get both. You really can.
Yeah, it can be
yeah.
a tool, strategic.
Yeah, absolutely. And so starting with small change, because we're all about, you don't need to throw everything out the window and overwhelm yourself. But starting with some small changes, where do you typically with patients, where do you start with like just some easy ways to kind of get started with that thinking and navigating such a big topic?
Yeah. Well, every case in the clinic is so unique, but in my personal opinion, we do have to ease into the conversation with a patient. It can be a very, very powerful tool, but the first time that I meet a patient, I don't really know anything about them yet. I don't know about their history of disordered eating. I don't know what is going on in their home or their lifestyle that could be challenging for them. So I'm not quick to just throw out a bunch of, therapeutic elimination diets or it seems like everyone is so ready for the next big thing that's going to magically cure all their problems. So I also tend to meet a lot of patients that have already done a lot. And so, with my background and having a board certification in nutrition, I'm not interested in subscribing to any one magical answer or any one certain diet or lifestyle. I believe in that personal medicine. So the first thing I'll start doing is inquiring. And I might hear some tips, and things that stick out in my mind. And as part of their treatment plan, I might write a few focal areas. One place that I love to start is glucose management, which I can expand on a little bit, but I tend to go to that as a very foundational strategy that most people need help with. And also when I work in the clinics, I'm often supported by nutritionists or dietitians or even health coaches that are all functionally minded. And so that is an extra support person for the patient. So if I intend to use diet as a tool and the patient's very receptive and excited about that, and I even have patients who are, begging me for more dietary strategies, it's also my responsibility to equip them appropriately to make that successful.
I was gonna say I like that. And I also like sometimes the interviewing or asking questions. I think that's so important in healthcare because a lot of times, at least I'll come in to do a evaluation on a patient, and I'll sit there and I'll talk to them for 10, 15 minutes, like really try 20 minutes. So depending on what they need. But it really gives me the most amount of information to then start diving in. Whereas they're like, aren't you going to test me? Aren't you going to, I was like, I'll get there, I'm going to get there. But first let's talk. And I think sometimes that is, patients don't see the importance of just asking all the questions and really telling all the details. Sometimes, you'll ask, for example, do you have any bowel or bladder issues? And they'll be like, oh no, I'm fine. And then 4 treatments down the road, you find out there are issues that kind of lead to other things. So I feel like that interview is so important to really get an idea of what's going on in that individual personally.
Yeah, it's actually step one of what we were taught, all of us back in school, is to take a good health history.
Mm-hmm. Yeah. So as you're going through this history with your patient, and you're thinking as you're talking to them, is how are you thinking food as medicine one of the first thoughts that are kind of coming into mind, or is there a lot of other stuff too? How much does food kind of jump into the forefront?
I think for me, it totally depends on the patient, because in functional medicine, I'm sure much like you, there are a lot of tools at our disposal. And that also includes other referrals too. You know, I might meet someone in functional medicine and a dietary application might not be the best answer for them. So I have all of my tools plus everybody else in the healthcare field.
Mhm.
So, you know, it is a big focal point of what I am good at, what I do, but it's not always the right decision on day one for everyone. And I think also when I think about a case, you know, you have to kind of build from the ground up. And I feel like, you know, in physical therapy, you probably relate to this. You can't get distracted by the shiny, interesting, wild thing that everybody's excited about. You have to consider building a strong base.
Mhm.
And so in functional medicine and in dietary work, a lot of that is the simple stuff, you know, like how many patients have you met who talk about how fantastic their energy and sleep is? No changes needed. They're super satisfied with energy and sleep. It's like zero, right?
Right.
So, you know, we might start with something like that. And if a patient needs to build up their energy, I'm going to start looking about the logistics of how they eat. That's what blood sugar management is. When people hear blood sugar management, they think, okay, well, if I don't want to have diabetes, I should manage my blood sugar well. So that means I just can't eat junk. No sodas, no cookies, no pop, none of it. But blood sugar management is actually a lot about the logistics of how we do things. And it's about all of those little decisions. Do you eat breakfast in the morning or do you skip it? Do you have coffee on an empty stomach or do you have it with a meal? How many times per day do you eat or snack? Is it every 3 or 4 hours, or are you doing one meal a day? What about before bed? You know, in American culture, a lot of people like to have a snack before bed. What's going on there? How do all of these things affect your energy and sleep? So I often think about starting from the ground up. So on day one, if I'm discussing a lot of different facets of care with a patient, not just dietary, I might give them one small homework assignment. I might say, you know, I think balancing your blood sugar would really help support your energy. I'd like you to try to have every meal and snack with a protein. And then I'll give a few examples of what proteins are. And then they might say, oh, well, you know, actually, just realized as we're talking about this, I actually don't think I eat a lot of proteins. And then we'll pull up some things on the computer and things that they can look at or buy at the store. And so that's an example of something really small that might come in on day one.
Yeah, I like that. I've noticed a huge difference in my energy and sleep. Same thing with adding a lot of protein, and it makes a huge difference for me individually at every single meal I have. And I eat more pescatarian, so I don't eat a lot of other meat products. So I do eat some seafood, and so trying to find protein has been something that has been a struggle over the years, and proteins that work well for me and proteins that are healthy and that will stay with me so that I don't get those big crashes. It's been a journey, we'll say, and it's a constant growth. And I'm constantly reading and trying to learn. But what you're saying with protein is huge, absolutely huge. I don't know, Dr. Bobbie, if you feel the same.
I was never a big protein eater, in all honesty. But right now, I know most people know, but I'm pregnant, and I have found that if I don't have protein, like I get sick and I'm so hungry and I can barely make it through my day. So I've had to really increase the amount of protein that I eat. And I didn't honestly notice it until I experienced this. So especially that first little bit. Now I'm good. But I do notice if I don't have a good source of protein in each meal, I like get hungry very quickly and
Yeah.
nothing. And then I'm just like, feel like I'm eating all day and I don't feel good about that either.
Mhm. But you know what, Dr. Bobbie, I'm so glad you mentioned that and congratulations to you.
Thank you.
But doesn't it make intuitive sense to you that at different phases of your life, you're going to have different nutritional needs and different nutritional strategies, you know? So it doesn't make sense to me when a postmenopausal female comes in and perhaps the goal is weight loss, then they say, you know, I've been eating the same exact diet, I do the same exercises, I've not changed my life since I was 18 years old. And then they're like, but why isn't this working? Well, to me, it feels really intuitive that you are not the same person. Literally, your hormones are changed. Your life is completely different. And as the decades go by, your nutritional needs change as well. So it's a really good thing to update. And I love that you felt really intuitive with that and you realized it about your body and now you just went with it.
Yeah, it made a big difference. And I noticed it first trimester, I was very, very sick. And so um, that was all about carbs, salty carbs. But as I got into second, like that's when I realized like I didn't feel sick anymore, but I was just like felt hungry. And I noticed if it was just by accident, but noticed like if I added more protein, especially in the morning and like with lunch, I just felt better. And I wasn't like hungry and I could make it to like the next meal without like being starving. And I felt a lot better. So it was definitely an accidental find. But I had little PTSD after being so sick that like, I was like, oh, this helps. I'm going to do it. I'm going to keep doing it.
Yeah. But you know what, though? Protein actually does help nausea and sickness. I feel like a lot of people go for the carbs, but protein is actually helpful for that too.
Good to know.
Yeah.
Yeah.
I think when we think about these big changes, menopause, pregnancy, things like that, that you feel the changes a lot more because it's a bigger flux. I can tell you too, though, I notice I've got, patients that are post-surgical and their body is trying to heal an incision, all of the edema that's associated with that. It could be a training time of the year. It could even be heat associated time of year. There's how your body functions actually really is going to depend on what currently you're dealing with. And so I think just being able to pivot and have a little bit more intuitive sense of like, I feel like this isn't quite enough for me. And being able to understand how much nutrition plays into even just like post-surgical healing can be hugely beneficial. I think, Dr. Halland, I think you might see this in some of your patients as well with like, it's not necessarily big changes. It can be smaller changes as well.
Yeah, we have a lot of post-surgical patients as well. I completely agree. Hydration needs go up, need for protein and amino acids, nutrient status in general.
Mhm.
You could even go more micro than that, though.
Mhm.
What about people that are menstruating?
Mhm. Yep.
Hormones fluctuate every
Yep.
single month. Iron might be changing. Some people will notice symptoms like they might have an increased desire for carbs and sweets because the hunger patterns change. So this could be as micro as on a week by week basis.
Mhm. Yeah. And I think the more, and not to be overwhelming about nutrition, but I do think that having the awareness of cycles in life, having the awareness of what your body's current needs are, and sometimes those needs are going to be higher for healing a wound, or like all of a sudden the weather's really warm and you're sweating more. Maybe you're training for something and so your exercise level goes up. Maybe your job changed and you're now working a job where you're lifting a bunch of stuff during the day and you're not sitting behind a desk. All of these are ways that you can use nutrition to support what you're trying to get out of your body on a day-to-day basis, and instead of it fighting you. And that fight, I think, is what we typically do.
Yeah. And when I'm in the clinic with a patient, sometimes it can get really overwhelming to think of all the things that someone could be doing or all of the tools that they could utilize. And sometimes the patients feel that too, because they say things like, well, I just don't know where to start. Or they say something like, I've tried everything, but I just cannot find the right thing for me. And so whenever I feel that way in a case, when I feel kind of, overwhelmed or there's so much to do that I don't know where to begin, I've realized, because I've done this for well over a decade, and I've realized that the answer is you begin at the beginning. you build a strong foundation. And to me, foundation means things like, optimizing your energy with blood sugar management. It means hydration, getting great sleep, and all of those things that, again, I know they're not exciting and shiny, but they're very, very impactful. And if you build a strong foundation to start, you will never go wrong.
Mhm. Yeah, no, I totally agree. And then from that foundation, I think you'll realize how you can feel. And then once you start implementing strategies of like blood sugar management, for example, you will sense when something isn't what it could be. And then it's like, oh, well, typically I can actually go this far in between meals, or I sleep better, or whatever it might be. And so one thing that I'll use is journaling. Not like necessarily like, tell me all of your, feelings about life. That's helpful for some people, but more like, I think it helps to see the pattern because it's like right there in front of you. So today, what did I eat? How did I feel? And how you felt might not correlate right with what you ate. So if you look at how you felt in the evening, what did you eat in the morning? And so you can kind of see what's going on, and you'll start to make the realization. So sometimes we'll start to do that together, like, hey, bring that in. That's accountability. So then you start teaching that tool of giving them the strategy of this is how you can figure it out for yourself in the future. So once we start seeing those cross connections and patterns, and then we start saying, okay, now what were the variables? Here's what you did. Here's how you felt. What were the variables that were going on? And then all of the lines start connecting. And then that growth and knowledge starts like really going in the right direction. Do you like to use journaling, or like what are other strategies you use for the patients to really kind of grow with it?
Yeah. Well, I do agree with you that empowering people for the long term, that comes from knowledge. That comes from equipping them with skills. And sometimes you have to build on that. That doesn't come day one. So if I'm working on a case typically supported by a functionally minded nutritionist or dietitian, they will typically do the accountability and the journaling with the patient.
Mhm.
And our journaling is not just food. You can also track bowel movements, you can track moods and energy levels, or you might have a patient, let's say, for example, their primary complaint is migraines. So we'll have them use, a migraine focused app for their tracking. And so I do like to do a lot of that, but I still want to think about it in a holistic perspective.
Mhm.
So, accountability with dietary change, I think, can be pretty important. And when I'm working on a case with multiple different systems involved, or different facets, or referrals, or blood work, or what have you, sometimes I won't be the one that will actually be doing that, but I'm a big fan.
Mhm.
So I've heard you say a few times, and growing up, you always hear breakfast is the most important meal of the day. How true is that? From a physician, especially a functional med physician, like how much truth is there in that? And like, what is some good ways we can start our day strong?
Yeah. Don't you hate it when old wives' tales and things that moms say actually turn out to be right sometimes? Well, again, I mean, personalized medicine is everything.
Mhm.
So when I assess someone's blood sugar management, I'm going to look at their fasting glucose, their hemoglobin A1C, and their insulin marker. And from there, I can kind of help them see, does what you're currently doing, is that working out for you really well or not? Or how can we change that to become more strategic and optimize these lab markers? As a general statement, I think there are some conditions that benefit greatly from strategies like intermittent fasting. But in my population that I most commonly work with, which is women in their 40s, 50s, lots of hormone changes in that period of life, lots of adrenal dysfunction, which is where our stress hormones are made, that builds up over time. I find in that population, in those scenarios, I have seen a routine meals and snacks plan work out better. And having breakfast 30 to 60 minutes after you wake up is so good for your adrenals and stress management hormones. And people report that they just feel better when they start their day with a high protein breakfast. And of course, there's stipulations to this. Okay. Your protein should be really, your high protein breakfast, you're going to feel differently if you eat donuts in the morning with coffee versus, a nice clean protein.
Yeah, I notice a big difference for me, for sure, when I don't eat within 30 to 60 minutes. It's like I almost feel like I'm more irritable, just like the little things that wouldn't normally bother you. And it's just so, even if you have like a bowl of cereal that isn't like, it doesn't cut it. It really, like, if you just stick to it, it really does help. Like it's super helpful. Start your day off right. Your whole system feels like it's like more awake. You don't have that grogginess. Eating is so helpful. It's
Well,
really
it's
good.
like just fueling your body.
Yeah.
I mean,
Yeah.
you can believe how many people I work with, particularly women, since that's my main population, but people that are under fueling themselves.
Yeah.
And sometimes it's because they're too busy or they don't have the organization and strategies ready, or sometimes it's even because of, archaic nutrition advice from the internet telling people that, if you eat the absolute minimum calories, you're going to magically somehow lose weight. So they start dramatically under fueling themselves, and that doesn't feel good to the adrenals and the body. That makes it feel very threatened. So, when people say, oh, I typically skip breakfast, I have maybe my cup of coffee, and then when it comes time for lunch, maybe around 11 or 12 when I'm at work, I just get like so hangry. I feel so sick if I run late and I can't get to lunch on time. That's blood sugar dysregulation. That means that you should have eaten earlier than that. So all you can do is kind of try it and see how your body responds.
Mhm. I think eating sometimes as well can be one of those things, kind of like drinking, where if you wait until you're really hungry, it's almost a little bit too late and you're a little bit behind the eight ball. I think from there, then there's that tendency to maybe overeat or choose something that's not the best thing to choose because it's quick and fast. And so then that's like one thing kind of leads onto the next, where if you kind of have a plan set in place that you're like, okay, I'm going to try the strategy and stick to it and make it easier for yourself. So like a strategy that we use is I have my smoothie pre-made. And so that way in the morning, it's really fast and I don't have a lot of time. I do have two small kids. And so I actually drink my smoothie on the way to drop off. And so that way I know that I'm going to be, and I've got like multiple types of protein in my smoothie. And so that way I know I have to sit in the car. So like if I can drink it while I sit in the car because I'm doing drop off, then it's just efficiencies kind of built in. But it's just like drinking. You can't wait until you're thirsty to drink. You've got to drink prior to being thirsty. Same thing with being hungry. I'm not starving in the morning when I wake up. However, if I wait till I'm starving, all bets are off.
Right.
Yeah.
Yeah. So, sometimes I'll work with patients that they don't feel hungry in the morning, and asking them to try to put in a protein breakfast is really challenging. So in that example, I'm going to reveal a secret here to the listeners. So what I'll have them do is to put some collagen in their coffee, which is a protein, and it's a popular strategy that people are doing already. Or I might ask them to eat just a nibble of protein. It doesn't even have to be a meal. It doesn't have to be a whole, smoothie scenario. If you tolerate eggs, you could eat one hard-boiled egg. That's a lot more protein than 0, which you previously had,
Mhm.
So it's not about the size of the meal. It does not have to be complex.
Mhm. Yeah, no, I completely agree with that. Decreasing complexity sometimes is going to be a better place to start because it's easier to implement. And you can cook those in advance and have them ready to go. So
Mhm.
it's nice and
Yeah.
fast.
You could even pre-buy them cooked and peeled in a package if you didn't even want to do that.
Exactly. All sorts of fun ways to make it simple.
Yeah, I think I'm kind of shockingly logical at times too, but I think it's because, I'm also a mom of a younger kiddo and, I'm also working and we're trying to manage a lot. So,
Mhm.
Yeah.
Yeah, I think it gives you perspective when it's like you have to implement it yourself amidst the barriers that are there. So they're not barriers that will stop you. It's just like, okay, it's not as easy. I'm not gonna have this long stretch of time. So when you yourself have to think like that, it helps, I think, with giving advice of like, hey, I get it. Like, I know this is tough, and what I'm asking is going to be not the simplest thing, but we can have strategies that make things simple. And Dr. Bobbie and I did an episode earlier this month about meal planning. And if you have the organization and want to meal plan, then you can really set yourself up for success for the week because everything is kind of done ahead of time, or you at least start stuff ahead of time, which will make it easier to implement as the week goes on. And then accountability, you're kind of helping to hold yourself accountable. So, and then if it works, great. If something doesn't work, try a different strategy. So,
great. I
yeah.
couldn't agree more.
Yeah. Awesome. So if somebody like just starting out, like they're like, okay, what if I want to start a couple of things just quickly on my own? Maybe I'm not ready to talk to a functional medicine doctor. Maybe you are, and you should look in your area because they're great. But let's just say I just want to start a couple of things to get myself pointed in the right direction. So we've talked about, the glucose management, eating breakfast. Is there anything else that you would say, like, here's like a little tip or trick that is easy to get started with thinking about nutrition?
Well, I would say that my tip is going to have to be don't forget about beverages, not just foods.
Mm-hmm.
So, good hydration is so important for our body's waste disposal system, the lymphatic system, for our muscles, for preventing headaches and keeping our minds clear. So, we want to have good hydration. And I think one of the best small daily micro indicators of hydration is the color of your urine.
Mm-hmm.
So, you want to have urine mostly throughout the day that is light, pale yellow. You don't want to overhydrate so much that you're clear all the time. And you also don't want to have medium or darker urine. So that's a pretty easy place to start. And some beverages are dehydrating. So you might want to consider reducing those, increasing water. And I think you're going to notice your brain gets a lot more clear, your energy goes up, the smallest things can really help. My second tip would be making sure that you're including more protein with meals and snacks and considering the timing and logistics of how you're eating in case you do need to eat more frequently or in more of a planned and strategic way. And then my third thing I would say is anti-inflammatory power. Most chronic diseases that we're aware of have their roots in inflammation. And in addition to that, from the chemistry perspective, inflammation doesn't feel good. It makes our tissues and our muscles feel really yucky. It clogs up our brain. Most mental health conditions have roots in neuroinflammation too. So if you could do anything with your diet as a general statement that I think is going to apply to most people, it's to find opportunities for anti-inflammatory power, more good guys to fight bad guys in the body. And what does that look like? Well, I like to use the joke of eating the rainbow. And I'm not talking Skittles rainbow. I'm talking vegetable rainbow. So, when you go to the grocery store and you see the produce area with fruits and vegetables and how beautiful these colors look, those colors are called antioxidants, which fight inflammation. So you want to have about 75% vegetable, 25% fruit, every color of the rainbow represented every day. So if you are working on the color red, an example could be, cherries, red. And then you go all the way through, but you also have to include white and brown as colors of the rainbow as well, so that you don't miss out on mushrooms and onion and cauliflower. Those are colors too. And I would say if I could challenge you to do anything, it would be to see if you could get one serving of every single color of the rainbow every day.
I love that.
I
I
love
think
that.
that should be our
Absolutely.
challenge.
Yes. Yeah.
Okay.
I
Let's
think
see if
that's one of the number one things when patients ask me, like, what do I even think about when I want to change my diet? And I'm not a nutritionist, so I can't give specific information. I do refer on for that. But I always say one thing you can read about is anti-inflammatory diet. And lots of stuff is produced about that. There's a lot of literature out there. And so always it's like, why not look into that? It's not going to, make that tendonitis go away. It is going to be something that's going to help your body, though, to decrease the amount of inflammation and everything else that you've got going on. So yeah, colorful plate, colorful day. There's like, you're not gonna go wrong with that, unless you have some sort of sensitivity, things like that, obviously. Be mindful of that. But
yeah, a good example is like cruciferous vegetables and broccoli. There are some groups of people whose stomachs can't tolerate that very well, so that might be a little bit harder, but lucky for them, there's so many opportunities that are green produce. So I'm sure there's something we could find that could substitute that. But speaking of foods as power, broccoli, for example, really great at helping our body detoxify estrogen.
There we go.
That's kind of fun when you start learning about what exactly could that food be doing for me.
Yeah, I feel like food, it's like, this is just, the tiniest tip of the iceberg when it comes to food, and how much knowledge you really can gain, and how really working with somebody that is highly trained in food as medicine can be great for you as an individual, but then also, maybe other people that that you like, you're like, hey, maybe help point them in the right direction. Sharing knowledge is how we're all going to grow together to continue to learn and grow as a society and as a community. So definitely, if you are listening to this and you want to learn more about Dr. Halland, we're going to have her information in the episode description below. And if you just want to look up functional medicine in your area, then you can just do a Google search on that. I'm in Jacksonville, so I'm not in the same areas as Dr. Halland, but I do know we have a number of good providers down here. And there's providers all over the place. And I think it's the field is growing, and I think it's becoming more aware of how beneficial it can be. So Dr. Halland, thank you so much for coming on. Our challenge for this episode is definitely, I love the challenge of the rainbow. So it's something I'm going to be trying for myself. I will say, like, every day I don't do that, but it is actually like how we try and eat is in a colorful way. And plus it's just more fun because it's like your plate's prettier. So it's not so boring. And other things that I like to always mention is that we are on social media. So follow us on Instagram and Facebook. And then we do have the 2000 Ciders. So if you want to join to make sure that you are getting as much information as possible on a monthly basis and going live with Dr. Bobbie and myself, check out the site to-gals.com and you can join from there. All right, everybody. Well, stay tuned for what we have coming up next.